right now. I am Councilwoman Mosley Samples from the city of Akron, and I thank you all for having me this morning to be here twofold, not only for my sister and our soon-to-be Congresswoman Nina Turner, but as someone who understands why we need Medicare for all. A lot of you all I know and I have met, and I told you all the story about my dad and his health insurance, him being in the hospital and them not wanting to cover it. This is a man who has worked every day since he was 13 years old. My dad was in the hospital, ended up having to have his foot amputated, and it was only after I had to call the CEO of the hospital to come to the emergency room. They wanted to give my dad some naproxen and send him home. You should never have to feel like you have to call the CEO of a hospital and demand treatment for your family member or yourself. They came down, saw my dad. My dad had a quarter-size ulcer on the bottom of his foot. Less than 24 hours later, he had half a foot. Fast forward, my dad's health just started declining. Doctors not wanting to, well, insurance companies not wanting to cover things. They didn't even want to cover his prosthetic for his foot. They didn't want to cover the shoe he needed for his foot. So we finally ended up just paying for it out of pocket just to get away from the bullshit. My dad ended up getting sick again while we were on family vacation in Pennsylvania. He went to the hospital, but as you all know, we were in the midst of COVID. So for 2 days, we could not see my dad after he went into the hospital. This is someone who had just had his foot amputated, having issues, but someone who had worked forever, paying into a system that did not care that my dad was having health issues. For those 2 days that we could not see my dad because they had to do a COVID test for him, only one person could come in the hospital. By the time we were able to see my dad in the hospital, they had already put my dad on a ventilator. Never once did we get to ask him what did he want us to do because he was on a ventilator. So we started having these conversations with these doctors about getting my dad back home. And this is where it gets tricky with these insurance companies. One doctor is saying we can get him back home. The other doctor was like, no, we want to keep him here. And to me, it was like, oh, they want to keep the person that's going to be able to give them some billables here in their system. 18 days later, nobody could come up with a plan to get my dad back home where his doctors were. Even the hospital in Akron tried to work out a plan for them. And guess what the insurance company told us? No. We could transport him 62 miles. And we would have to figure out the rest. We were 467 miles away from home. So our family, we were on the phone calling life flight people, calling paramedic people, trying to figure out how to get my dad transported home. We were talking about $20,000, $30,000 is what they wanted to charge us just to try to get him home. Because an insurance system that he had paid into forever told us, we'll pay for 62 miles. And I said to them, so what are we supposed to hitchhike once we get to 62 miles? Because how are we supposed to get him home if he's on a ventilator? By day 21, we had to make the hard decision to put my dad in hospice. We had to put him in hospice and say our goodbyes 467 miles away from the entire family. I stayed the whole time. My family had to keep coming back and forth because an insurance company did not see the benefit in all the time my dad had paid into this system to get him back home with his family. We don't know what that outcome would have been if he had been with his doctors. We'll never know. Because that was taken away from us because this insurance company did not feel it was important enough to try to get him home where his doctors were. And like Yvonka said, my dad had passed. And guess who started getting bills? My mom. Threatening to put liens on a house. Bills, they all just, it seemed like the day we started planning his homegoing service, they did not wait to start sending us bills. Bills on top of bills on top of bills. So the one thing that I would like to see, the one thing that I've talked very openly with Senator Turner about is we fight for Medicare for all, but we also have to fight for when a family member passes away. Whatever is owed should be forgiven. So now you're putting hardships on a family who is already struggling to say, hey, sorry that your loved one died, but we got a $30,000 bill here for you. There has to be a system that stops that. And we have to have a system where your health insurance should not follow a job, period. I shouldn't have to go and work somewhere crappy just so I can have health care coverage. I should be able to have it, period, because it's a human right. And so we have people who get caught up in wording and semantics. It's sort of kind of like when you hear people say, defund the police. That's not really what it means. We're talking about reallocation of funds. But people hear defund and they get scared. They hear Medicare for all, they get scared. But those same people, if you go and talk to them and say, hey, don't you think everybody should have free health care coverage? And they'll be like, absolutely. Well, we're saying the same thing. But you guys are getting caught up in the wording because we say Medicare for all. So you say free health care coverage, absolutely. Oh, no, but not Medicare for all. They're the same thing. So it's about the wording that people are getting confused with. But it's all the same thing. Everyone should have free health care coverage. And we should get rid of all these deductible and co-pays. As somebody who, I have an iron deficiency. I just do. I don't even want to go and see my doctor to even get my iron infusions because I know I'm getting a bill. I know I'm going to get a bill, and I have insurance, but the co-pays and deductibles are ridiculous. I just got a bill for $748 just for having infusions, and I have health care coverage. Went to the dentist and had some extensive dental work done. I have dental insurance. I still got a $3,000 bill in the mail after the fact, and I still paid into it. So this whole system is rigged for the rich, and it's going to be up to people like us to dismantle that system. And we just have to keep doing it. Some days it gets heavy, some days we get tired of it, and it seems like we're all preaching to the choir right now, and we're preaching to the choir, but the choir has to go out and preach to other people and bring them in so they can understand. Those heartstring stories make a difference. They make a difference because people have to be able to relate to it. We all know somebody who has diabetes. We all know somebody who probably has hypertension. We all know somebody that has some pre-existing. Once they start understanding this is what we're talking about, it clicks, it matters, and then they buy into it. And that's what we have to do. We have to get people to buy into it so that they can go and talk to their congressmen and women, to their U.S. senators, and say, listen, it's good to sit there and posture and say you co-sponsor something, but have you went and talked to those ones who don't support it to get them on board? That's where the real work is. We have to get those other on board so they can understand the importance of Medicare for all. And again, it's all about the wording. Health care coverage is a human right. Should not follow a job. Get rid of the co-pays and deductibles. And if you want to see a system change, a system that actually works, when we get this through, and we will, and I do believe we will get it through. I honestly do believe that. Because we have a fighter, Anita Turner, who's going to go there. She has people there to already support it. You know, and the more people that you put in that space that can advocate for it, they'll have no choice. And we have to tell people, don't wait until it affects you or someone in your family to say, yeah, we should probably have Medicare for all. We should do it now, even when it does not affect us. So I thank you all for having me. I will sit up here all day and talk to y'all about my dad, but I'm not going to do that to y'all. But let's just keep the fight. Keep fighting. Because it's important for us to be in this space and speaking to people and telling them the importance of Medicare for all. I mean, it's simple. Everybody deserves free health care coverage. You shouldn't have to feel like you can't go to the doctor because you're afraid a bill is going to come. You shouldn't have to feel like you have to use the emergency room as your primary care physician because you can't afford to go to one. So thank you all for
making those resources available to those. You know, we cannot expect somebody to take a 2-hour bus ride for a doctor's appointment. We've got to have the resources and the materials and the labor and the availability that are easily accessible by all. We have to have equity in our healthcare system so that every person gets care according to their needs, not according to some algorithm. So if you're 25 and you need a colonoscopy, you get it. You know, you don't have to wait until you're old enough for those things. Okay, we have to have participation at a meaningful level of all. You know, not just participation in selecting a plan. That's not participation. The participation in determining what that plan covers and how it covers it and who it covers. We have to have that input. We have got to have transparency so that we can easily see how decisions are made in our healthcare system, you know, and what went into that. And the last thing is that healthcare system has to be accountable to you and me, to the patients it serves, not to investors on Wall Street.
I know that's right.
Those things have to be in order to have it be just. So if somebody wants to fight with you over whether it's a human right, tell them, fine, I just want it to be human rights standards, because we're talking about quality that doesn't exist in our healthcare system. Thank you for covering.
And I watched and listened and learned, and I woke up and said, I've got to do something. And so, number one, I showed up, and I continue to show up when I can. And so I congratulate everyone who's here today who showed up, and do what you can do is the bottom line. So if you are a brand new activist and are unsure what to do, just find your niche and find your way. And I thank all those entrenched activists who are here doing some of the deeper work, where they research how to get things done, and where they research how to talk to people, and where they research what the issues are. And Deb can tell you every statistic about Medicare for all and the fight for single payer. And it's incredible work that people are doing. I personally have just simplified things down. I don't want a label other than I'm a humanitarian. I want to work for people because we are humans, and because we are humans, we deserve certain rights. Healthcare is a right. Simplify it down that healthcare is a right. And that's why I'm here today. We don't have to earn it. And if COVID hasn't told you that, then nothing will. You know, the fact that we are all intersectional in our struggles, and the fact if one person struggles, the rest of us will struggle. If one person has COVID, the rest of us potentially might have COVID. And just this intersectionality, like a spider's web, we are all connected in this fight. And so again, simplify it down that we need to love each other, respect each other, and take care of each other. Healthcare is a human right. And because we are humans, we deserve health care. Anyway, how do you make a difference? It's really about showing up, and it's about telling your story, figuring out what your bottom line is, and understanding who you are in this fight and in this struggle. So as I've learned when I've done door knocking and phone banking, if you can simplify it down to a couple simple phrases for who you are and be able to tell your story. So when it comes to healthcare, I know we all have stories. I have stories about my own family, about the daughter who had to come home because she couldn't get mental health care in Chicago and had to come and live at home because there was not availability. I have stories of my patients, of the 40-year-old mother who failed to show up because she was afraid of the deductible and the copay and the test. And it took her so long to show up that by the time she got there, her right breast was triple its normal size and hard as a rock. And yes, it was stage 4 breast cancer. And we all have these stories. So I want to challenge you to think about what your story is or what your family's story is. How many of you have anxiety about health care, and what if you get in a car accident? How many of you have delayed going to the doctor because you are afraid of the deductible and the copay and the tests that they might order? How many of you have not filled a prescription because it was too expensive? How many of you are a small business owner and really struggle over figuring out health care for your workers? How many of you have stayed in a job that you hate because you need health care? How many of you would be an artist or an entrepreneur or a musician or something else full time if you had health care? These issues affect all of us. I had a list of those things that goes long. Oh, here's a few more. How many of you have a pre-existing condition? How many of you don't have dental care? How many of you don't have vision care? How many of you can't afford a hearing aid? It goes on and on and on. The key as you become an activist in this is know your story and be able to tell it to the people opposite you. Because it is the stories that make the difference as we try to win this over. As we really work to get profit and greed out of our healthcare system. The system is not broken, it is designed to profit a handful of people. But the system doesn't work, and this is why when something is a right, when healthcare is a right, we have to get profit out of healthcare. We will never fix the system until we get profit and greed out of the system. Incremental steps. Okay, fine. I'll take the little pieces. I'll take the fact that it's all of a sudden we're going to be able to get hearing aids at the pharmacy. But is it enough? No, and I'm not fighting for those little steps. I'm fighting for something big. If you came to me and had cancer and I said to you, let me put a bandage on it and let's see how that goes. No, you want me to send you to the oncologist. You want chemotherapy, you want surgery, you want radiation, you want aftercare, you want supportive mental health care. You want it all and you deserve it all. We deserve it all because we are humans and we should be taking care of each other. So we must get profit and greed out of healthcare, and the way to do that is to show up, start telling your story, start telling the story of your family and your neighbors, and get everybody on board for this. This is not a partisan issue. You know, again, what's your label? Be a humanitarian. It doesn't matter. The rest doesn't matter. Anyway, I thank you all for being here. Thank you for showing up. I appreciate it.
To improve the coverage and expand it to all. Don't let people tell you differently. That is what we want to do. We want to improve the coverage so that it is comprehensive, and we want to expand it to all. But the other part of it is not just making insurance coverage or healthcare coverage available. There has got to be equity. We have got to meet the human rights standards in order to have it be a just healthcare system. It has to be truly universal. Nobody left out. If they are on American soil, they get treated. No question there. Secondly, we have to have the resources spread out so that it meets the needs of the people. It does not do us any good to take the resources from the poor communities, from communities of color, and put them in the rich suburbs. You know, why can't we get health care?
To avoid providing health care benefits. And I was one of those people who was hired as a private contractor. So to my employer, a millionaire, a multi-millionaire, who could avoid paying health care benefits. I thought it was wrong then. I think it's wrong now. Benefits that people need in order for them to live. We have so many people that are skirting those issues and not willing to say, we need to make sure that we have a comprehensive system that has dental and vision and health care. Something that people don't have to worry about whether they have the copay to pay. Usually when you go into the hospital now, the first thing they ask you, they send the billing person in. So you're on the bed and the billing person comes willingly in the computer, right? To find out what kind of insurance you have and if you have the ability to pay. As an African American woman and a nonprofit director, my life expectancy is lower because of the lack of health care insurance for many of our nonprofit directors. Affordable care, the Affordable Care Act was an important step. It helped many to be in a race, but there are still so many that are still waiting to get to the gate because they can't afford the admission fee. Medicare for All is the great equalizer. It is the only way to create equity in a system that has left so many people behind. A comprehensive system that, we have to have a comprehensive system town to visit my 89-year-old grandmother and gave it to her. And I went to her house to help her live. And I almost died. Right? I went into the hospital, had to go to the emergency room to demand a treatment. Not a treatment was given, but to demand a treatment in order to save my life. My grandmother, who was also in a hospital with COVID, lived. For one, because we took very good care of her at home before she went into the system. So she only had to do oxygen a little bit. So this is her story for you today. So my grandmother, who is now 90 years old, said I was laying in the hospital watching them bring young people into the room and watching them bring them out deceased. And I wondered, when was it going to happen to me? When was I going to die? When my grandmother went over to her care after COVID, which should have been included in the CARES Act, they started sending her bills for tens of thousands of dollars. Right? My uncle, who was 68 years old, so there were 10 of us who in my family who were all impacted by COVID. My uncle, who is 68, who had no comorbidities, he knew that if we had COVID, he had it too. We're all there together. He started to feel ill one day. We asked him if he needed to go to the hospital. The first thing he said is, I can't because I don't have any health insurance. The next day I came to see him. His arm was white. I said, you need to go to the hospital. Something's wrong. The next day, his arm was black. The next day, his arm was amputated.
Oh my God.
My uncle is 68 years old. He was in the hospital for 2 months. He is now an amputee. The first thing he says when I visit him, which I'm visiting him after this, is, do you see what happened to my arm? Do you see what happened to my arm? My grandmother said, your uncle has some mail. I opened it up to see what the mail was. And the mail was his bill. Right. For $100,000.
Oh my God.
For a 68-year-old man with no health insurance. $100,000 for COVID care that should be included in the CARES Act. Billing error?
No.
My bill for one day in the emergency room to receive a mitoneal antibody, $6,800. I had to call them and say, you billed me wrong. This should be included under the CARES Act. And they said, oh, well, let's fix this. So then they started sending me other bills. So Medicare for all, for us, for our community, is that great equalizer. It's a way to make sure that the things that I'm talking about don't happen. My uncle should not have had to worry about, I don't have insurance, so I can't see the doctor. His arm should still be there. My grandmother should not have had to worry about the bill that she got from the nursing facility for being cared for after her COVID treatment. I should not have had to worry about the $6,800 bill that I received for my care. In America, we should not have to worry about whether we live or die because we don't have health care. Medicare for all of us, is that great equalizer. It's a way to create equity in a system that has not been equitable. And I thank you all for your time.
I wanted to say first that I've been a member of CCPC since before it was even CCPC. But I'm also connected with SPAN, with Our Revolution, with the National Nurses United, with Physicians for National Health Care, with Progressive Democrats. Many groups nationally and many groups locally are pushing for Medicare for all. And we need to, at some level, support all of them, whether it's just putting our name on as a a member, even as a non-contributing member, because that shows support. I've been politically active at some level or another since I worked on the campaign, volunteered on the campaign for Eugene McCarthy back in the late 1960s. And there have been changes, but there's so much that's the same. So I've written down 3 bullet points for myself to remind me of what I want to say. And the first one says, every politician, and I want us all, I'm talking about tactics now, because I think we're all convinced that Medicare for All is the way to go. Every politician, that means every person who we vote for as a precinct committee person. That means every person who's in the school board, everyone who's on the city council, every mayor, every state rep, everybody. And when I get a request for money, how many of us get requests for money from politicians? Yeah. And I get a lot of them, and a lot of them are via email. So my first thing, and usually they say, I oppose this awful person who's currently in the position. And my response is, do you support Medicare for All? Everyone, it goes back, do you support Medicare for All? And I tell them quite clearly, you want my support, you must support Medicare for All. Lately on Facebook, I'm seeing a lot of signs for Tim Ryan. And my response is, why didn't you co-sponsor Medicare for All? When are you going to come back and support Medicare for All? But every politician, now we're fortunate in having Nina Turner running, because we know that she supports Medicare for All. And we know that she's the only person in the 11th congressional race who is a strong supporter of Medicare for All. A lot of the big companies are not in support of Medicare for All. But at any rate, Nina Turner is the only person in the 11th congressional district race who has a possibility of getting elected who supports Medicare for All. If you support Medicare for All and you're in the 11th congressional district, there is no reason whatsoever why you should vote for anyone other than the one candidate who supports Medicare for All, and that is Nina Turner. So, every politician. My second thing is spread information. Now here we are, and we support Medicare for All. There are a couple faces I'm not totally familiar with, and I'm not 100% sure that everybody supports Medicare for All, but the vast majority of us, and probably everybody, supports Medicare for All. But we have friends, we have relatives, we have neighbors who think that we can't afford it. We have friends who think that Medicare for All is the same as Medicare. We have friends who don't understand the horrible consequences of waiting another year or 2 or 3 or another decade or another 10 decades or whatever it may happen to be. So what we need to do is tell them, and there's so many ways. One easy way, I started a Facebook page, and I haven't been real successful with it. It's called Momentum for Medicare for All, number 4. And my goal with that was that every day, many people would spread one message. 68,000 people die every year because they can't afford health care. Medicare for All. Put that up. Everybody, if everybody here put that message up once a day, or some message once a day on Facebook, we would have a lot of people who would understand what they don't understand now. 650,000 people a year go bankrupt because of medical debt. How many people don't understand that? Most of the world doesn't know that. Go to that site, spread that detail, Put it up every day. Takes you 3 minutes, maybe, if you're slow or if your connection's bad. Other things that people don't know. People don't know that there are at least 22 studies showing that we are going to save money with Medicare for All. They think we can't afford it, that it's going to be expensive. Spread the information. Send it via email. Put it on Facebook or Twitter or Instagram or TikTok, or I don't know all the things that there are. I don't keep up. Young people could probably educate me on that. But if we all go to a site or 2 sites and spread some of that information every single day, take that minute or 2 every single day, spread the information. And don't just spread it to the people who we know. Great if it comes out in a spam newsletter. It's great if it comes out in an Our Revolution newsletter. It's great if it comes out in whatever. But it needs to go out to the general population. Because there are people who still think that it's not good. They don't understand that it would be good for seniors. That senior citizens would get their glasses and their hearing aids and their dental care and their mental health, much less everybody else. But they think that it wouldn't be good for seniors. They think that it wouldn't be good for people who already have health insurance. Well, if you're in a union and you have to bargain for your health care, you're not spending that same time and that same effort bargaining for your working conditions, bargaining for your pay, bargaining for all the other things that are important for you in your union. So, 1 was every politician. 2, spread the information. 3 is from every point of view. Okay, let's say I'm one of those people. I have a friend, actually. I went to a movie with a friend, and I was talking to her about Medicare for All, and she said, but I got that. I don't pay anything. I've got my my dental, and I have no co-pays, and I've got everything. Yeah, she's one of the rare ones. But then you tell her that you don't want those 68,000 people dying every day. You don't want that on your conscience. You want that same thing for other people. And especially for the people you care for. You may have it, but your son or your cousin or your grandma or your granddaughter may not have that. And you want it for everybody. Another thing people say, school teachers. I'm told that school teachers, one of the unions, I don't remember which one, the 2 major school unions, but one of them is opposing Medicare for All. Well, what is the benefit of having Medicare for All to teachers and school administrators and parents? It's that the school district would no longer have to pay for health insurance for its employees. Little East Cleveland spends $4.5 million a year on health insurance for employees. $4.5 million for a small district goes a long way. And we all know teachers are buying supplies for their classrooms, and they're going without and whatever. They would have $4.5 million to spend for education instead of spending it on health insurance. Cities in general are spending, again, millions and millions of dollars, and I don't have any figures, but we know it's true. Cities are spending lots on health insurance. Our cities would have more to fix up the potholes. People want more police, well, they'd even have that, but that's not one of my priorities. But if you're looking for something for those people, something that will hit home with those people, They'll have more to put into social services, more to whatever, more to fix up your parks. Whatever it is. You're talking about healthcare disparities. Our laws, our maternal and infant mortality in our African American population is disgusting. It is really, really high. One way to decrease that is to make sure that all of those people have health coverage. And especially, we know that the health of the young women and the young girls before they get pregnant has an effect on their health during pregnancy and health for babies. And if we want to lower our maternal and infant mortality, we need to pay attention to the health of those non-pregnant young girls. You can't wait. You can't wait. Taking care of prenatal care, that's important. We do that with Medicare for All too. But it has to be for everybody if we want to really lower the mortality. So whichever group you're looking at, whichever concern they have, try to address a concern of theirs. So what was point number one?
Every politician.
Every politician, precinct committee, school board, everything. I was one of the large minority, significant minority of people who voted against the Democratic platform in 2020 because it did not include Medicare for all. If we get more proactive on making sure every level of politician we elect is concerned about Medicare for all, we will have a greater chance of getting it